Haplo stem cell transplants are still experimental, and therefore I do not believe that they are the best option at this time. And even though there are experimental protocols being proposed, I don't believe very many people would say they are the best curative option at this time. But that's part of the debate tomorrow. Well, haploidentical transplant is when you do a hematopoietic, meaning blood-forming cells transplant from a relative who is not a full match in the HLA system. In other words, a father or a mother would be haploidentical with one of their children. Now, siblings might be either completely identical. There's a 1 out of 4 chance of them being completely identical. There's a 1 out of 4 chance of them not being even haplomatch, and there's a 50% chance that they are going to have one allele which is the same as the others, and so in that setting, it increases the number of available donors for transplants tremendously. Now, for example, in sickle cell disease, if you're going to look at only matched sibling transplants, it's believed that only about 18% of patients are going to have a matched donor. But if you go to haploidentical transplant, for children, virtually everybody will have a donor because the parents will be around. The issue as to whether it is a curative therapy for sickle cell disease will be debated tomorrow. Now, the procedure is not a difficult procedure to do, but the degree of take of engraftment has been very variable among sickle cell patients. And while some are proposing new regimens or new protocols, others believe that this still is an experimental procedure and should be reserved only for certain patients with sickle cell disease who have very severe disease and no other options. Now, if there are available fully matched donors, those are the donors of choice, of course. And very rapidly, gene therapy is coming onto the scene. So that adds another level of complication, in addition to other new therapies that are being developed. Now, of course, stem cell transplant is a curative modality, whether it is fully matched sibling transplant or a haploidentical, a half-matched transplant. But again, those kinds of transplants need to be improved upon and refined, in my opinion.